Also tonight, hospitals in the metro on high alert now that 16 cases of measles have been reported in our area.
We're worried about seeing more cases right now as we speak.
What they are doing to try and contain the disease when patients come in. Hospital officials told us today we are not out of the woods yet when it comes to the possibility of more cases being reported.
One expert telling us 6 weeks is usually the time window hospitals give before giving the all clear. 41 Action News reporter Kat Reed live now at the University of Kansas Hospital, where one of the cases was reported. And Kat, what are hospitals telling you about this epidemic?
Well, Mike, Krista, the University of Kansas Health System, as you mentioned, and also Children's Mercy in Kansas have been listed as those measles exposure sites. And they tell me they're very used to dealing with infectious diseases. But we did talk about some of the particular challenges with containing measles and also protecting the most vulnerable, which is, of course, people who are already sick. If you visit Children's Mercy Hospital, you may see one of these signs posted on the wall.
When we hear of one case of measles, we know there is not just one case of measles, there are always more.
Dr. Marianne Jackson is the director of the Infectious Disease Division at Children's Mercy. The emergency department at their Kansas hospital was one of nearly 20 measles exposure sites related to this outbreak. Perhaps most frightening is the danger the virus presents to many people being treated there.
So especially those babies between 6 and 12 months are at risk, but we also have children in our institution who have cancer, transplant, are receiving other immunosuppressive therapies and can't receive the vaccine.
Infectious control experts have a very specific protocol when it comes to measles. Staff suit up in protective gear before entering measles patients' rooms, which also have special ventilation systems.
It's a higher rate of air turnover, and also it gets vented directly to the outside rather than circulating within the hospital.
Over at the University of Kansas Health System, they're dealing with the aftermath of a different outbreak. State officials say a Missouri patient contracted measles while traveling outside the U.S., then visited the hospital.
We're always concerned when anyone with a possible infectious disease has been in the hospital, but was recognized very quickly. They did not spend very much time in the waiting room and really did our best to keep that patient in isolation after that.
Both hospitals do tell me that they use standard disinfecting techniques when it comes to cleaning the rooms where the measles patients have been. Now, this is very, very important. If you think you may have been exposed, do not just show up at the doctor's office or an emergency room. That can just expose more people. You need to call first so they can take the necessary precautions. Reporting live in KCK, Kat Reed, 41 Action News.
The measles rash is red or reddish brown in color. It starts on the face and works its way down throughout the body over the next few days, from the neck to the trunk to the arms and legs, until finally reaches down to the feet. Eventually, it will cover the entire body with blotches of colored bumps. The rash lasts from 5 to 6 days. We have all the list of places where health officials say people may have been exposed to the measles. The majority are on the Kansas side in Johnson County. You can find that list right now along with times of potential exposure at kshb.com.